those of you who don't know, Shannon Whittington is a published author and certified speaker. Her expertise includes the LGBT community, diversity and inclusion, as well as servant-based leadership. She has received the Quality and Innovation Award for her work with transgender population, and also the Notable LGBTQ plus Leaders and Executives Award. So yeah, incredibly impressive work. And I reached out to her to just learn more about, gaining tips for organizations such as Rome, to understand how better to, have diversity and inclusion, and what sort of tips she can give us. So before we start, I'd just like to say a few words about Rome. So Rome stands for Recruitment of Healthcare and Medical Experts. So we're actually a startup. We came up with a innovative app which helps nurses and HCAs, as well as other healthcare professionals, find extra shifts that they can do. And just throughout hospitals in London, and hopefully expanding as well to other areas. And traditionally nurses use agencies, and it's quite time consuming and quite expensive to find nurses that with the right skills. So our app helps make that a lot faster, easier, and cheaper. So that's where we're working with mostly nurses, and so I think this is a topic that's really important for nurses to really learn more about. So with that, I hand it over to you, Shannon.
What you all are doing at Rome is great. I mean, I hope this spreads across other countries as well, especially like America. I used to do a lot of per diem work myself when I was younger and gallivanting all over different places when I was living in Atlanta. And I had to register with all these different agencies, and then they give you a call. And now that I think about it, it was kind of complicated. And of course, at that time, apps didn't exist. So if there's something that could make it easier for nurses who want to get extra shifts and just go through an app, put your skill set in and what your availability is and your hours and the shift that you could do, I mean, wow, I think that's fantastic. So I hope this startup turns into something big that, goes across the country. Thank you so much for joining. That shows me that you're interested in what we're going to be talking about today. I speak all over the country, and this is a topic that, often is overlooked, and so it's great when I'm asked to speak and share knowledge. Look at this flag, everybody. I don't know if you all have seen this, but this is the Chevron flag that was released here about 2017 here in America. I don't know, can you see that back there? The reason why I like this flag, okay, so this is the pride flag, what's the all-inclusive flag. And the reason why I like this flag is because all these colors are the pride colors, right? But now they're incorporating these colors for trans, we'll get into that, for transgender, brown for people of color, black for people whose lives have been lost to HIV. Just really beautiful. Now I'm gonna speak like really basic 101, and I hope I'm not preaching to the choir here. So just bear with me with that. If I freeze, or because this happened yesterday, if I freeze or I don't know, something happens where you can't hear me or something, Pooja, you gotta text me, or because I'm not gonna have LinkedIn open. I don't know how you're gonna do that, but I guess we're just gonna go with it. Okay. All right. So let's go. All right. So here's our pride flag. How beautiful is that? I'm always wondering when I'm speaking in different places, or when I go to different places, how welcoming is this healthcare organization going to be to me as a gay female? I am a cisgender, gender-conforming, binary gay female. My pronouns are she, her, and hers. Been married to my wife, my wonderful wife, for 21 years. Well, together 21. We couldn't get married for a long time. So I want to know how organizations are going to make me feel affirmed when I come in there. And that's kind of some of the things that I want to talk about today, particularly with nurses, healthcare professionals. Are we being inclusive for this population? Now, if what I just said when I, introduced myself sounds like I was speaking another language, have no fear, I'm going to explain to you what that is. Normally these presentations are a lot longer, so I wish I had more time with you all today, but we'll do our best. All right, so I'm going to give you some thought-provoking questions that I really want you to think about when it comes to your organization. Now, if I were to walk into your front door right now, would I feel included or would I feel left out? Would I feel left out? In other words, would I have one drink and leave? Or would I stay for dinner because I'm having such a great time and I'm enjoying myself and I am feeling a part of your organization? That's the question. That's the real question here. So what I want to know is, how does LGBT look like in your organization? Have you ever even thought about this? Sometimes when I'm giving talks, because, as Pooja said, I speak about servant-based leadership, which is all about adding value to others and kindness. And I often notice when I'm looking at the curriculum, there's nothing about this being discussed, And then sometimes when I'm invited to talk about this, what happens afterwards is people come up to me and they're like, oh my God, our organization knows nothing. Oh, can you come and talk to us about that? They didn't realize that they knew nothing. So that's why I'm glad you all are here today. So just think about that when you walk back in the door of where your practice is. How does it look in your organization? And is your organization proud? Is your organization LGBTQ plus proud? Because even on your social media, how does that look? Is it proud? Think about, who are you connecting with? Are you connecting with everyone that looks like you? Or are you connecting with people who don't look like you? Are you connecting with people who are only in your area or all areas? That's really something to think about, especially if you are on social media. I really want you to think about who you're connecting with. Because let me tell you something. A lot of times when I go to organizations, this is what LGBT looks like. It looks like nothing, absolutely nothing. But that's going to change today because you all are here. All right, so who am I? Pooja introduced me a little bit. I'm not going to stay on this slide forever, but I'm a nurse. I'm a clinical nurse educator, and I've been a nurse forever, I feel like. And then I've gotten some certifications and stuff like this, and I'm back in school yet again. All right, so let's talk about this. All right, the elephant in the room. The first thing I want to say to everyone here is I'm not trying to convert anybody, all right? But I am here to alert everyone. And the alert is, this isn't going away. LGBTQ is not going away. It's just going to get bigger and bigger and bigger. Now, you don't have to agree with it. You don't have to agree with my lifestyle. One of my buddies sent me this video yesterday, and the guy was saying alternative lifestyle. People who are living alternative lifestyles. Okay, you want to call it alternative lifestyles, that's fine. I'm not trying to convert you. I am here to alert you. And all we are asking is for us to be the best expression, to be allowed to be the best expression of ourselves. Oh, I'm doing good. I just admitted somebody. I'm going to admit whoever pops up. Did that make my screen free? So that's the question. How, we good? Okay, that's the question. How affirming and welcoming is your organization? Or how affirming and welcoming are you individually to this population? So look at these colors. I explained a little bit of them before. Black people, brown people, these colors, life, healing. It's not just some random flag with colors on it. The colors actually mean something. So I wanted you all to know that: sun, nature, harmony, spirit. It's really a beautiful meaning behind this flag. And there's so many other flags that can be, you know, you might, I don't know if you see these in your area, but sometimes I might see these as I'm out and about, and this is by no means covers all of them. I just want you all to be aware that there's many. So this is the chevron that I explained to you earlier. And, you know, last year with Pride, it was World Pride, and it was amazing. Now, I live in New York, which you can pretty much, you know, be out here. And it was like Pride paradise. It was everywhere. And these companies, you know, did all of these type of, you know, they changed their logos. You know, it made me want to open a bank account at TD Bank. It made me want to fly American. It made me want to drink vodka. Made me want to watch Netflix. You know, like Nike, made me want to go buy some Nike shoes. Even go to McDonald's and eat some some hamburgers and French fries, because I felt affirmed when I saw this, and it was so beautiful. And I know, speaking of COVID, I'm so glad that this was last year, not this year, because it would have just been a disaster. But this makes us, as part of this population, feel welcome, feel valued, feel safe. You know, when my wife and I go to the store, this is what we look for. This is what we have confidence in, that this is USDA Organic. Now, I don't know what they have in your neck of the woods, but this tells us that this food is safe to eat. And if we don't see this, we tend not to buy that particular product. So when we're traveling down any road, USA, you know, driving with the top down, and we want to stop to eat, drink, have, you know, stay, we're looking for affirming imagery. All right. I'm looking for that flag. And if I'm down any town road USA and it's time for us to eat, I'm looking for the flag. Guess what? If I see the flag, that's where I'm going to eat. Why? I know that I'm going to be safe there. Now, provided Yelp says it's good food. Okay. But, you know, I was going through my mail the other day, and I got this thing like, welcome to our retirement community. Now, I'm so far from retirement community, hopefully. But what's interesting is I just flipped it over, getting ready to toss it, and this is what I see. You see that there? Now, if I was looking for a retirement community, don't you think I would check this place out? Because I would feel safe there. And I'm going to save this pamphlet for if I ever have to go into a retirement community. But here's the thing. You can't just like hang out a shingle and go, oh yeah, you know, we're prideful, we're gay friendly, you know, because that's going to bite you in the butt for sure. Because what's going to happen is someone's going to come into your HR department. They're going to see the big pride flag there, and they're going to say, oh, I'm so happy that your organization is, you know, supports LGBT. And the secretary's going to go like, LG what? Oh yeah, they put that flag up here last week. I have no idea what that's for. So, you know, you don't want to be like Homer and be like, duh, I don't know what happened. You know, you really got to think this through before just hanging a shingle. What's the cost of, you know, not having inclusive environments? It can be to the tune of $64 billion. You know, if we work in an organization where we don't feel affirmed, we leave. You know how expensive it is to train employees, and then they leave. I worked in an organization for 2 years. I couldn't be out. I fell in love with one of the nurses there, and you know, we had to come in at different times. We worked on the same floor, the same shift, and we didn't want anyone to know, and we couldn't leave together, and it was just horrible. I felt like I had to hide all the time. I couldn't have lunch with her because people might think something. It felt so restrictive, and I ended up not staying there. And then I've worked in organizations where I feel completely comfortable being out, and oh my gosh, what a difference it makes. So let's go into this a little bit and talk about what these letters mean. Now, what I want you all to understand is this is a linguistically fluid language. It's always changing. Usually that particular word will last about 4 or 5 years, and then it will change. So you might see this acronym written out, LGBTQIA, even longer. But we're going to go into the basic one here. L for lesbian, 2 girls together. I'm gay. I call myself gay. I don't really like the word lesbian so much, but some women use that, but we also use the term for gay, which usually means 2 guys together. Then we have the bisexual people, B for bisexual or bi. These individuals can be attracted to men. They can be attracted to women. They can be attracted to trans people. Just whoever they happen to like at the time. Doesn't mean they're confused or anything's wrong with them. And it doesn't mean they have to pick. Like society wants them to pick, but it's just whoever they happen to love at the time. My girlfriend, one of my best friends, is bi. Sometimes she's with the girl, sometimes she's with the guy. And it doesn't mean they're like super, super promiscuous. It just means that they like both, and that's fine. And then we have T for transgender, or trans for short. These are people who disagree with their assigned anatomical sex at birth. Their assigned anatomical sex at birth. That is a disagreement that they have. Again, they don't have a mental illness. There's nothing wrong with them, and they're not confused. All right. They just don't agree with what they were assigned at birth. And then we have Q for queer or questioning, which means they can be attracted to anyone. Like the plus can include the I for intersex, which is the new term for the old term hermaphrodite, which means that these individuals were born with maybe both sexual characteristics, chromosomes a little different. Sometimes people don't know they're intersex until they go through puberty or try to conceive. And for you nurses, and if you're working in, OB, and if a baby is born, if you have anything to do with it, a lot of times the doctor and the parents will make the decision at that time what the sex of the child should be. Then the child grows up, doesn't feel aligned with their gender, and they're like wondering what's going on, and then it's this big secret. So try to advocate, let that child decide for themselves what their gender is going to be. Now, pride flag, this is another one here, doesn't have the chevron on it, but I just wanted you all to see that. This is the American flag. This is the trans flag. Now, I don't know if you all knew that transgender people have their own flag. And the blue for boy, pink for girl, white for maybe transitioning or don't feel like you belong in either one. And no matter what way you turn this flag, it's always right. And I personally really like it. So we have the symbols, 2 women together, 2 men together. This is a heterosexual union here. And then we have this symbol for transgender, or trans for short. So let's think about in your organization, does everybody look the same? Are you hiring people who may look non-binary, gender non-conforming, feeling like they don't fit into this particular box? Because these individuals have an awful lot to offer if they are given the opportunity to do so. They just want the same opportunity. I mean, let's think about this in organizations. Diverse teams make better decisions 87% of the time. I don't know about you, but I would like to make better decisions 87% of the time. Look at our top 10 countries for gay, LGBT. Belgium and Ireland and Portugal, and America's not on here, unfortunately. But that tells us what our top countries are. Let's talk a little bit about gender expression, because people get this confused sometimes. We have our anatomical sex, which we were born with, right? Cisgender, my sex that I was born with, I agree with that. Then we have our attraction of who we feel attracted to. I feel attracted to my wife. And then we have our identity, what we think and feel in our head. All of that together makes up our expression. So the way I like to describe it is sexual orientation is who I go to bed with. That's my orientation, who I go to bed with. Gender is who I go to bed as. I go to bed as a woman, gender. I go to bed with my wife, sexual orientation. 2 different things. And in fact, Facebook lists over 76 different gender expressions the last I checked. When I first started doing this work like 4 years ago, it was like 30. And I was like, oh, I'm gonna learn all these words, but they changed, like I said. So we have cisgender, agreeing with what you were assigned at birth. Like if you were born a female, signed with a vagina, you agree with that. Cisgender, I'm a cisgender woman. We have the gender fluid, which means that people can, switch back and forth between genders. The expression, like how we dress, how we act, our marker, what's on our personal records. We have gender non-conforming. These are people who feel like they don't really fit into a certain box, male and female. We have dysphoria, gender dysphoria. This is what transgender people are diagnosed with, that says that the body part that they were assigned causes them discomfort. All right. I talked about intersex, conforming, queer, going between both. Some people feel like they don't have a gender at all. And what I want you all to be aware of is that, you know, in my country, it's male or female, but there's so many other words to describe. Look at all these words. This is just a few of them. But what is really a problem, especially here in America, is that these are the two choices that you have, male or female. Yet there's so much that's in between these two boxes. It's called non-binary. It's called TGNC, transgender non-conforming. And if people are allowed to be the best expression of themselves, they would feel much better than having to pick between these two rigid boxes. So I want you to look at your intake forms when you go back to your organization and tell me, do you only have male or female? Because if a trans person comes in to apply for a job, what are they going to choose? They may just choose male or female depending upon how they identify, but look how it could look. We could have trans man, trans woman, genderqueer, something else, leave a line. I don't want to answer. That's fine. What sex were you assigned at birth? And of course, all of this stays confidential. All right, because back in the day, this was pretty much what we had to choose from. You may have had an other, right? And now we've got all of these things that we can choose from. Like here, you've got to pick the language you want when you're at the ATM machine. You've got to pick the language you want when you're calling your credit card. So it's really good if you could have, you know, more choices here that makes people feel like you are an inclusive organization besides just the male and female box. That's what we really have to get beyond, is this male and female box. So I want to talk a little bit about transgender and what that entails. It doesn't mean that these people are gay, right? When I first started, I was like, all trans people are gay. Nope, they're not. Some are, yes, but they could be of any gender expression. They could be of any orientation. So the best thing is just don't assume. Don't assume. Because most of the time, you're going to be wrong. Like, I spent an entire summer at the Transgender Clinic, Center for Transgender Medicine and Surgery. Every 30 minutes, a trans patient was coming in for a consultation. And, you know, they would have someone with them. And I would be like, oh, that's a girl, that's a boy, I was wrong every time. So I just learned just not to assume and just see people. And, you know, it's just so much better when I look at it like this. So I want to talk a little bit about this population and some of the social determinants. These individuals have limited support, limited housing. Most of them live on less than $10,000 US dollars a year. Okay, so that's way below the poverty level. They face social isolation and despair. We won't hire them. And they face healthcare discrimination, which is really, really horrible. We as healthcare professionals discriminate against them. Now, excuse me, I don't know what you think when you see this, like you're living in a world that doesn't want you. And this is, you know, this isn't just here, this is in other countries too. Like, it's really bad in other countries. I'm not going to get so much into the murders, but we're killing people like on a regular, trans people, specifically Black trans women. But if you look at all of this, this is a perfect recipe for suicide. You're living in a world that doesn't want you. You can't get a job. I've had so many trans people say, Shannon, I did good on the interview on the phone, but when I went, I knew I wasn't going to get it. I mean, look at this. So many can't change their IDs. They're rejected by their family, homelessness. 47% have attempted suicide. Now, these aren't just statistics. Like, these are like real statistics, because I would ask people this when I was seeing trans people at the clinic, and have you attempted suicide? Most of the time they said yes. And they're like, oh, I've got to get, you know, a tattoo, you know, I'm not suicidal anymore. But this is what really bothers me right here. Why is that? Why is that? Because we don't know how to take care of them. Why? Because we weren't taught. I wasn't taught. Research shows that healthcare professionals get about 2 hours of training in this area. I'm still waiting to meet that nurse that got those 2 hours. You know, I did a lecture for Columbia University yesterday, and they got their 2 hours because they got their 2 hours from me. But you know, that's something that has to change. It really does. They seek healthcare just like we do, and they need knowledgeable clinicians. And trust me, it's not that hard. You know, we have taken an oath to do no harm. We must uphold this oath. Now, I want to go into pronouns because this is so important, particularly when you're talking about people who are non-conforming or non-binary. It says it's going to end in 10 minutes. I guess I need to fly now, Pooja, unless you can switch that. Anyway, I guess if we just get cut off, we get cut off. But
if we get cut off, we can rejoin the same link and we'll reconnect. So it's not a problem.
All right. All right. I'm real good at rejoining. All right. So here's the best practice. If you have someone that comes into your practice and you don't know, like we're not going to assume, right? We are not going to assume. You might have somebody that comes in with a mustache and a beard and lipstick, or female dressed very masculine. So you're not going to assume. If this is an intake and you're going to be doing care for them, what's your gender marker at birth, which means what were you assigned at birth? How do you identify? How do you identify? They're going to say, I identify as male, female, trans woman. My gender is female, male. I'm trans. And be aware of the language that you're using. Don't make any assumptions, because especially with trans people, their voice may not align with the gender that they are telling you, and their appearance may not align with it, in your opinion, right? So we have the male voice, which is way down here. We got the female voice, which is way up here. And the trans voice is somewhere in between. Like, I can pick up the trans voice pretty much because I talk to them all the time. And it's just a certain tone that I get. Now, however, I must say, with 12 speech therapy sessions, the voice can be feminized or masculinized. But a lot of times these individuals don't have access to this. So you're just going to ask, how would you like for me to refer to you? They're going to tell you, and they're going to appreciate that question. What pronoun or pronouns do you use? How would you like to be addressed? Basic stuff. You can ask these questions and then write it down. You know, when I'm talking to all of my trans patients here, I draw the little symbol, you know, for the female or the male. And that way I know that I'm talking to male or female, not how it sounds, but I have to look at my paper, because a lot of times these individuals haven't changed their name, because remember the slide, some places they can't. My state of Tennessee, you can. This is what you want to avoid: misgendering, offensive words, unhelpful questions. What are unhelpful questions? Well, let's just put it like this. Don't ask anybody anything you wouldn't want them to ask you, right? Like, don't ask them how they have sex. Don't ask them if they had the operation. I think I have a slide for this coming up. But because when you misgender a trans person, like, that's like the worst thing that you can do. Like, I would say that's in the top 2 things, to misgender a trans person. It's offensive. It hurts their feelings. They feel mistreated. In fact, here in New York, if you continuously misgender a trans person, after they've repeatedly told you my pronouns are she, and you're like, I'm not going to use she, I'm going to use he, you keep doing that, you can be fined $250,000. Yes, it's that serious. So I really want you to be aware of that. Pronouns are everything. And if you use the wrong pronoun, just say, I'm sorry. I didn't mean to be disrespectful. I apologize. This happened to me yesterday. I was teaching a class. A trans woman was on the call, and I could see her, and I misgendered her. And she said, it's she. And I said, oh, I'm so sorry. And then you keep it moving. Okay. That's not the thing. It's not the theme. You know what I mean? The pronoun is not the thing. It's not the theme. In other words, if you make a mistake, apologize immediately. I'm so sorry, and keep it moving. That person is not there to comfort you for your mistake of misgendering them. They don't want to do that. They want to get to the business at hand. Walgreens here, which is a huge drugstore, has all gender inclusive bathrooms now in 3,000 of their stores. Like, how cool is that? So of course, you know, this is where I go for my pharmacy needs. But what I want to say is, this doesn't happen overnight. You know, it takes time, it takes practice. Practice makes permanent. It takes self-reflection. And, you know, initially, if you want to make some changes in your organization, you are going to run into some obstacles. You're going to have staff that aren't enrolled in what you want to do. Your leadership staff, your senior leadership staff probably thinks it's not that important. People fear what they don't know. There's unconscious bias. Here in America, there's over 9 million LGBTQ plus people, 1.6 of whom are trans. So what does that tell me? We're everywhere. We're in your organization. And guess what? We're getting healthcare. And we want to get it where we feel affirmed. So these are some of the things that you can do in your organization just to get started. You can collect SOGI data, sexual orientation, gender identity data. Big companies ask this, of course, people can decline. The intake forms that I talked about, trying to serve underrepresented communities, forming employee resource groups, because if you don't ask, you're never gonna know. You're just never gonna know. Because, you know, as Oprah says, we all want to be allowed to be the best expression of ourselves. And that's really true. It's not like we as LGBT people are asking for anything any different than anybody else. We just want the same thing you do. Be allowed to be our best expression, hire us, live in your housing, you know, just let us be. Like my mom says, you be you and I be me. So I want to say thanks. And we're going to have for questions, but I also want to say, this is how you contact me. If you need me to, you know, speak at your organization, the best way is LinkedIn, as Pooja can tell you. I have my own consulting company. If you email me, I will send you the first chapter of my book for free. And then I'll let you know when it's coming out in case you're interested in it. So that's it. Pooja, I guess I should stop sharing, right? Oh, you're still on. Yeah.
Yeah, if you can make me host as well, that'd be great.
Oh, now she's asking for something. What to do? I don't know how to do. What do I do?
Thank you so much. That was very insightful. And you know.
Hang on. Where do I stop being the host? Somebody smart, tell me.
Let me check. Oh, I can do it myself.
Oh, you know, it's probably going to. Yeah, do it.
Okay. Okay.
Oh, now you're the host. Okay.
So yeah, does anybody have a quick question for Shannon?
Yes, Fabio.
Hi, Shannon. Thank
Hi.
you for inspiring. I'm Fabio. Nice to meet you.
You too.
So I'm a nurse like you, and I actually did work in theater, and we did transgender case. So I know exactly what we're talking about. And there was a big debate, like about doing this kind of operation into the NHS, because as you mentioned before, those people knows what they want, right? They don't have any mental issue. So a lot of people say like it's not right to cover the cost of this kind of procedure under the NHS, right? It should be a kind of private practice. But most of the people justify that by saying that these people need it because they have actually a mental issue and they need to swap to feel like confident with themselves, etc. Otherwise, if they cannot afford for it, they will feel the pressure, they will feel bad, and they may have then mental issue. So what is your vision about that? What do you think is right? Do you think like this should be covered? Because sometimes people say, well, it's like having a breast augmentation done. So it's like every woman then should have it done on the NHS because it's something that they feel great with themselves and they need to change, they need to do something about it. So what's your vision about
Yeah, this is really controversial and people have their opinions about it. You know, what they have found is for individuals who do, like first of all trans people don't have the surgeries. Sometimes they just look that gender and they don't do anything to their bodies. Some of them are so dysphoric about that body part that they choose to have the surgery. I personally believe, because what we have found is that individuals after they have had the surgery, the majority of them adjust well into society as that gender that they feel like they should have been born into. And they're no longer have this dysphoria, and they just have such a better life. So here in New York particularly, they band together, they sued the insurance companies because they weren't wanting to pay, and they won. And then we also have special needs plans that cover all of those surgeries. So I'm delighted that these surgeries can be covered, and that will always remain controversial.